Exercise in school. Before exercising, there are a few things to consider. The young person's glucose levels should be checked, and if it is less than 5 millimoles per litre, exercise may need to be delayed, and an additional carbohydrate snack may be needed. There is a table on the next slide to give more guidance about this. Following exercise, the young person's glucose levels should be checked again, and more carbohydrate may be required. This will depend on what the young person is doing next. If it is nearly a meal time, additional carbohydrate may not be needed. Please refer to the individual healthcare plan for further information. It is important that the young person's hypo remedy is available nearby, such as on the side of the pitch or swimming pool, rather than in the changing room or locker. This table gives further guidance on when it is okay to exercise and when exercise should be delayed. It also gives more information about when additional carbohydrate may be required before exercise. A copy of this is available in the individual healthcare plan, so please refer to it. Snacks to consider before exercise. The previous table refers to having 10 to 20 grams of carbohydrate before exercise as required. This slide shows the amount of different food and drinks that is needed to give 10, 15 or 20 grams of carbohydrate. Examples of snacks after exercise if required. At times, a snack after exercise is needed. If this is the case, it is important to have food or drink that contains complex carbohydrate, such as milk, a banana, or a piece of toast, rather than fast-acting carbohydrates, as outlined in the previous slide. These quantities may not be suitable for all children, and staff will need to refer to the individual healthcare plan or discuss suitable options with parents or carers. Exercise when on a pump. Some children will use a temporary basal rate on their pumps when participating in activities. This will vary from child to child. The local diabetes team will have trained the family regarding this. Therefore, please discuss this with the family and refer to the individual healthcare plan. The Seren Active leaflet for coaches is available for further support. During exams or tests, most young people will experience different levels of stress from this pressured time. Exam stress can impact on young people with diabetes, affecting their blood glucose levels, making blood glucose levels unstable, with the young person possibly experiencing hyperglycemia highs or hypoglycemia lows. High and low blood glucose levels will affect the young person's concentration and ability to perform during exams. Additional time may be required to ensure symptoms are managed promptly during exams, including time for treatment to work. Prior to exams such as GCSEs or A-levels, schools can apply to the examination board for additional time for young people with diabetes. The extra time is allocated if they need to treat high or low blood glucose levels. For young people with diabetes, blood glucose levels need to be within the normal range of 4 to 7 millimoles per litre, ideally with a blood glucose level greater than 5 millimoles per litre at the start of any exam. Time will be required for young people with diabetes to undertake blood glucose monitoring prior to starting the exams or tests, and also support if additional tests are required during the examinations. Key messages. Students should be allowed to take drinks and snacks into the exam to prevent or treat hypos or hypers. They should also be able to take their blood glucose monitor and or their sensor and insulin treatment into the exam. They may also need to take time out to treat a hypo or a hyper, and they may need to visit the toilet. These are supervised diabetes management breaks where the clock is paused until they have recovered. All invigilators must be briefed appropriately in order to support young people with diabetes during exams.